Hello, how are you doing?
Fine, thank you.
Good. My name is Kwame. I'm a student nurse at Dulce School, and I'm here to do a head-to-toe assessment on you. It's going to take approximately 15 to 20 minutes for us to be done with this assessment.
Okay.
Now, I'm going to wash my hands and then provide privacy for the patient. Okay. And when I come in, I'm going to say, my name is Kwame. And what is your name?
Bernice.
Bernice. Okay. Now, I need to have an identifier. Okay. Can you tell me your date of birth?
September 26, 1977.
September 26, 1977. Okay, now I'm going to tell you 4 things that are non-related. Okay, to check for your thought process. It's going to be apple, ball, car, and a dog. Okay, apple, ball, car, and a dog. I would like you to repeat this to me at the end of the interview. Okay. Now, are you in pains? Do you feel any distress? Do you have any difficulties breathing? Anything?
No.
Do you have to use the restroom before we start this interview?
No.
Okay, all right. So I'm going to start to check the cranial of the patient. I'm going to palpate to check for any lumps and check for any masses or any protrusion. There are no lumps, there are no bumps. Patient's head is normal cephalic. The head is symmetrical. I will check the hair to make sure the hair is evenly distributed. The hair is silky. The hair is not dry, and the hair is oily. And I'm going to check the face of the patient. I'm going to ask you to also. One thing, I have to check the level of consciousness of the patient. Can you give me a thumbs up? Okay, can you wink at your eye? Okay, can you give me a high five? Okay, so patient is oriented ×3. Okay, so now I'm going to check for orbital edema under the eye. There is no edema under the eye, and the patient does not have any edema in the cheeks. The sclera of the patient is white, and then the conjunctiva is transparent. The pupil is black and rounded and reactive to light and accommodation. Also going to check for the peripheral view of the patient. So I'm going to use the pen light and shine it in the patient's eye. Can you stand for a second?
Sure.
Because I'm going to cover one of my eye, and I'm going to ask you to cover the same eye that I've covered, and then look straight at me, and then just follow the light. Look straight to my nose. Okay, and then follow the light. Okay, so patient's peripheral view is excellent. Kindly have a seat. And also, I'm going to check for the 6 cardinal gazes of position. I'm going to ask you to follow my hand. What number do you see?
2.
What number do you see?
2.
What number do you see?
4.
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 Okay, so from here, I'm going to check the ears of the patient. Okay, I'm checking your ear. I'm checking the back of your ear. There is no lesion. The ear is symmetrical on both sides, and the color of the ear is corresponding to the color of the face. I'm going to look inside the ear to make sure there is no drainage. Inside of the ear is pink, and it's the inside of the ear is pinkish. There is no drainage. Everything looks okay. Also, yeah, I have to check the other ear too. Yeah, pink, drainage. The ear is in position. There is no tenderness when it's palpated. Ears are soft. Okay, so the next thing is I'm going to ask patient to kind of raise the eyebrow for me to see. Okay, the eyebrow is symmetrical. There is no difficulties in raising the eyebrow, and also the eyelashes, the hair on the eyelash, the hair on the eyebrow is evenly distributed. Patient is able to blink the eye with no difficulties. It is involuntary, and I'm going to ask the patient to turn the head to the side for me to check the nose and make sure the nose is in midline, the nose is symmetrical, there is no deviation in the nose is not broken. I'm going to look inside the nose of the patient to check the mucus inside of the nose is red and moist and soft. There is no drainage in the nose. Everything is looking okay and normal. I'm going to also ask the patient to open the mouth and say, open your mouth whilst I check the tempora mandibular, and there is no spacing. It is smooth in movement. And also I'm going to ask you to stick out your tongue and stick it up, down, side to side, and then also, yeah, the tongue movement is okay. And also I'm going to shine the light in the mouth and check and say uvula is in the midline. Patient's dental are okay, hasn't lost any teeth, there are no cavities, and the tonsils is +2. Okay, so with this, I'm also going to check for three tonsils in the patient. I'll check for the one that is the preocular. Okay, it is freely moving. It is soft. It is non-tender. When it is palpated, I'll check the submandibular tonsil. The same thing on both sides. They are all symmetrical and is freely moving. They are soft. There is no deviation. And I'll check the one at the submantle. Same thing, it's freely moving. It is soft, it is non-tender. Okay, so from here, I'm going to check the neck of Venice. I'm going to ask Venice to turn the head to the side, turn to the side. Okay, turn this one to the side too. Okay, here the neck is symmetrical. I'm also going to palpate for the jugular vein. Turn your head to the side. Okay, jugular vein is okay. There is no distended on both sides. Jugular vein is okay. And also I'm going to check for the carotid vein. Okay. On both sides. And I'll use the bell to check for bruise. There are no bruise. And I'm going to ask you to stand and then turn to the side. I'm going to check the thyroid. Can you swallow? Okay, there is yeah, you can't feel the thyroid. Okay, on both sides. It's symmetrical. Check the trachea. The trachea is symmetrical in midline position. Okay, all right. So now, after this, I'm going to have a seat. Now, I'm going to check for skin temperature. It's normal, and the temperature is normal within range. And also, I'm going to check for symmetric brachial pulse. I'm going to check for the pulse, and I'm going to check it for 30 seconds on both ends. I check the brachial pulse. seconds, that's almost 68. I'll check the radial on both ends. There is good pulse here. For 30 seconds. Pulse is symmetrical and equal on both sides. I'll check the pulse on the popliteal on the knee for 30 seconds. It's equal. I'll check the dorsal pedis pulse on both sides. You see, I can't get it here. Huh? Okay, it's present. Open up your leg. And then I'll check the posterior pulse in the posterior ankle for 30 seconds on both ends. And I'll check the obliquity on both sides also. For 30 seconds. And it is equal and regular. Okay, so now I'm going to do the peripheral. Actually, what I'm going to do next is to check the vascular system by checking. I also check the skin turbine on both sides of the chest. Okay, skin recoils in less than 2 seconds. There is no swelling, there is no edema, there is nothing. Okay, so what I'm going to ask you to do now is to stand up, and then I'm going to turn around. Okay, so I'm going to check for the tactile firmities. I'll say 99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
Okay, so it's if there is a good vibration, there is good vibration. I'm also going to check for the sound, the lung sound. Now, when I place the stethoscope, I'll need you to breathe in and out. Okay.
Mm-hmm.
Okay. So since I'm here, I'm going to check I'm going to ask the patient to turn to the side, and also check for there is no barrel chest, you know. So I'm going to check for symmetry. Turn around. I'll pinch at an inch and ask the patient to breathe, just to see if, just breathe, hold it for a second, hold it. Okay, out, just to check for symmetry at the back. Okay, all right, I'm going to do the same thing at the front. 99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
Okay, now this is to check for vibration. Now I'm going to listen to the heart sound by checking the right carotid to check for the second intercostal space on the right sternal border. Is to check for the aorta. Second intercostal space on the left sternal border to check for the pulmonic. Third intercostal space on the left sternal border to check for the Epps point. Fourth intercostal space to check for the tricuspid. Fifth intercostal space to check for the mitral, apical pulse, PMI. Okay. And I'll use the bell to also check for the aortic, second intercostal space on the right sternal border, left sternal border, second intercostal space for the pulmonic, third left intercostal space to check for the Epps point, fourth intercostal space to check for the tricuspid, fifth intercostal space at the mid-clavicle line to check for the Epps, to check for the mitral, which is the PMI, and then apical pulse, and I'm going to listen to this for 1 minute. So now that's the next thing is I'm going to also check. You can have a seat. I'll check for the temperature on the skin again, and check for capillary refill on both fingers. Capillary refill takes less than 2 seconds to refill. The nail of the patient is rounded, and the nails are not brittle. Skin is looking perfect. There is no lesions. There is no dryness. So also I'm going to check for the capillary refill in the toes, and also check for edema. There is no edema, there is no swelling on the feet. The skin of the leg looks perfect. There is no swellings. Okay. So now, one thing I'm going to ask you to stand, and then also I'm going to check for muscle strength. What I'm going to do is resist once I push you down. Resist me, shrug your shoulder once I resist. Okay, good. Okay. Now, whilst you're standing, I need you to spread out your arms, rotate it in, rotate it out, and then up, down, up, down. Okay, now your leg lift, one up, okay, down, up, down. Your leg, rotate it in. Do the same, rotate it in. Okay, rotate it out. Rotate it out. Okay, so now I want you to kind of walk on your heels, just to check for balance. Okay, all right, good. All right. So now have a lay down, and let me check your abdomen. Check for bowel sound. Do you have to use the restroom before I do this?
No.
Okay, so I will check for the bowel sound in all the 4 quad. Okay, so bowel sound in all the 4 quads. So right lower quadrant, bowel sound is present. Right upper quadrant, bowel sound is present. Left upper quadrant, bowel sound is present. Left lower quadrant, bowel sound is present. Okay, so I'm going to palpate. Stomach is not distended. Stomach is symmetrical. I'm going to palpate deep. Check for the internal organs. All right. Okay. Good. So, can you have a seat? Okay. I think that's almost that's about it. Can you tell me the 4 things that I told you?
Apple, apple, bear, car, and dog.
Okay, so it was apple, ball.
Ball.
Okay, so patient stop processes. Okay. Okay. Thank you, Venice.
Thank you.
Are you okay? Are you in pains? Are you okay? Are you in distress? Is everything okay?
Everything's fine. Thank you.
Thank you.